Hey everybody, this is Dr. Hunt at Hunt Physical Therapy. Today we're going to talk about how you can safely pop your upper and lower neck with some techniques called joint mobilization at home. Before we go into these techniques, I just want to say if you're experiencing any profound neurological symptoms, for example, weakness, loss of sensation, or really severe radiating arm pain, before you do these techniques, it'd be a good idea to check with your local healthcare practitioner first, like your physical therapist or your medical doctor, and rule out some other things. But you know, that typical joint tightness, that crick in your neck that you experience when you wake up sometimes, pain and loss of range of motion into rotation or side bend. These techniques are perfect to try initially, and a lot of times you'll get that audible click or pop that you're looking for. So the first technique is one you can do for the upper neck. And so I'm going to show you facing and sideways so you can see all the angles really good. But let's say the tight joint's on the right side and you're having difficulty turning towards or away from that side. What I want you to do is simply look up, okay? And then side bend towards that tight side, maintaining that looking up position. And then with your fingers, kind of gently rotate your chin up towards your top side eye. So just kind of at that angle. And don't be real aggressive with this. Just kind of take it and rotate up like that. Mine just clicked a little bit. Okay. And do a couple of those oscillations like that. And a lot of times if it's truly tight, it will let go. So I'm gonna show the other side. So again, look up, side bend, and then with your fingers on your chin, rotate up towards the top eye, maintaining your head up and side bend, okay? So here it is, side view, look up, side bend, and then rotate up. Other side, look up, side bend, and then rotate up. And again, a lot of times you'll get that little click in the upper part of your neck. So this next one's really good for tightness in the lower part of the neck. Okay, so let's say the joint tightness is on the right side. What I want to do is stand with that side arm behind my back, so like this, okay? And then what I want to do is take my hand on the opposite side and side bend my head away. Again, don't force this. A lot of times just take it to where it's tight, and at the very least you'll get a really good stretch in this muscle right here called the upper trapezius. But a lot of times when I do this, there's a little audible click or pop in the lower neck. Okay, I'll show you from the side here. So the tightness is on the right, and I side bend to the opposite side. Okay, so I'm gonna demonstrate on the left side. And this is just a pure side bend, there's no rotation. Okay. All right, so another way to kind of get the middle and upper neck is to use a towel. Some people prefer this. I like this too because you can kind of dig in. One of the things we find a lot of times, people that have pain in this region, this muscle right here, the rib underneath that upper trapezius, is stuck in a slightly elevated position, and you can feel it a lot of times. Especially people that have been in car wrecks and they have that whiplash type injury. You push in that area and it's really tender, but there's just this hard bony infill in there. And so I like this because you can kind of push down on that rib with the towel, like I'm coming in at this oblique angle, okay? And just pushing down on that rib. And that feels really good. But to get the middle and upper neck, just take let's say it's tight on this right side, just take the towel and kind of put it along the angle of the jaw right there, and kind of look up, side bend, and then use the towel to rotate up. And just do that a few times. It's okay to pause for a few seconds. Don't really try to force it. A lot of times if that joint's ready to go, it'll go without a lot of overpressure and force. Okay? I'll show you from the other side. So again, look up, side bend, take the towel and put it along the angle of the jaw there, and rotate up towards that top eye. You can do that a few times. So a little stretch you can do for the upper neck, the muscles right here at the base of the cranium, we call those suboccipital muscles, is just stand with the towel right there at the base of the skull, okay? Look up, and then take the towel and just kind of pull up towards the ceiling like that. And you can just do that for a few moments. This one's more of a stretch for those muscles. Here, I'll show you from this angle, but it feels really good. A lot of us are tightening those muscles because things like working on a computer promotes that forward head posture where your head goes forward, but then you have to extend up, and so it just causes a lot of compression and tightness in those muscles at the base of the spine. So again, kind of look up, have the towel there at the base of the skull, and then use your hands to kind of pull up towards the ceiling. Get you a nice little stretch in that suboccipital area. Okay, so I always say prevention's the best cure. So I want to show you one of my favorite little exercises you can do on a table to kind of strengthen the neck muscles and stretch out the muscles in the back that tend to be tight. So we're going to go get on the table now. Here we go. Okay guys, I'm going to show you two things now. One's an exercise you can do that's really good for all kinds of neck pain, from bulging discs to tight muscles and joints. But I'm going to show you a bonus joint technique. It's more for your mid-back, but a lot of times I'll get a crack too in the lower part of my neck and upper back. So studies show the mid-back, the thoracic spine, and the neck, known as the cervical spine, are very closely connected. There was one researcher years ago that people with mechanical neck pain, he didn't even treat the neck, he treated the mid-back. And a lot of times, in many cases, the neck pain got better. So in some of these videos, I'll show you not just things to do for the neck, but things to do for the mid-back too. But first up, I want to show you a simple chin nod. And you can do this with a rolled up towel or a pillow. Just lie on your back and kind of place the towel roll or the pillow where it's really supporting that natural curvature of your neck. And then the movement is as if somebody's got their fingers on your chin and they're just pushing your chin straight back towards the table like that, okay? I like to hold for a few seconds and then relax. Tuck and relax. Hopefully you can see me okay. Tuck and relax. If you're having trouble turning to one side, for example, if you're having pain turning towards the left side, then you can tuck, and maintaining that tuck, try to turn towards that left side to free it up. It's going to hurt a little bit, but oftentimes we find if you go into the pain, you have more success. So you can do just the straight chin tuck or chin nod, and then you can do the nod or tuck with rotation towards the painful side. I usually tell my patients do a couple, 3 sets of 15 reps each day. Okay, so a neat little joint technique you can do. Most people don't have a hard treatment table like this, but if you go to a gym, oftentimes those workout benches, you know, where people do bench press and things like that, they're firm enough to do this. But it is useful to take a towel roll and put it towards the edge of the table, and then position that so it's in the center of your back. Okay, cross your arms. I've just got quite a few pops right there, and extend off the table like that. Okay, I like to cross my arms because it opens up the rib joints, but you can also kind of put your hands behind your head like this. And you can also extend your arms up like that as well. Okay. And just do that for a few moments. I hope it's useful. If so, please like and subscribe. Feel free to leave comments below, and look forward to seeing you next time. Okay, thanks everybody.